joints and palpating the movement. So basically, there's the two flat surfaces where they're sliding against each other, and it's going to move in a single plane. And that's what we'll talk about as we go through examples of all these different joints, is how many planes do they move in? Is it a single plane, multiplanar movements? And then we're talking about a hinge joint. And that's going to be there's two joints in the elbow. One of them is going to be a hinge joint, and that's going to be the joint with the ulna and the humerus. Okay? If you can feel that as if you feel here on the medial epicondyle. Right? You know what bone that's on? Is it this one or this one? It's in the humerus. Okay? So you know that that surface is part of the humerus, and then if you go distally to that, if you're moving your elbow, you can feel that this part's not moving, right? But then your olecranon process is moving here. Okay? And then as you try to get that gap between the two joints, you can go across here like where your funny bone is. Right? The tip of the base of your finger here is on the medial epicondyle, and then you can feel the olecranon is moving against it. Okay? So that's going to be a hinge joint. So that's movement just in one plane. Right? And what plane is that? Sagittal. And then the other thing would be interphalangeal joints, which is different than this joint here. And this one has more than a single plane. But here's another hinge joint. Now, pivot joint. So now if you go on the elbow on the other side, on the lateral epicondyle, so you feel the bone coming up here. And then as you go distally, what you're looking for is this right here. Okay, so that's going to be this portion here. So you're going to be feeling the lateral condyle here, and then you go across it as this rotates. So if you're on here and you go just a little bit distant to that, one part you'll feel it rotate. You'll feel the radial head rotate underneath your finger, whereas the lateral epicondyle is not moving. Okay, it's a little tough for me. So it just takes practice. But if you go more to the posterior part, you're going to feel it a little easier and feel the radial head. Everybody can feel that? So what plane does that movement occur in? Right? You do the twist, right? And then also another similar type of joint like that is between the atlas and the axis, or between C1 and C2. So that you're not going to be able to tell. All right, so now you have condyloid or ellipsoidal joint. It's kind of like a ball and socket, but it's not quite as deep as some of the other ones. Both surfaces are going to be oval shaped, so it's not a complete round ball, but it's more of an oval shape. And then that's where you're going to find those at the metacarpal phalangeal joint. Those also are abbreviated usually as MCP. So that's going to be this joint here. Okay? So with your finger, you can do this, right? So it's not just a single movement plane. So how many planes of movement can this joint do?
3.
Well, you can't necessarily really rotate it that much. So it'd be more of 2 planes. Yeah, so it's talking about biaxial. So it's angular movement, or what you call circumduction. Okay? You can't really rotate the finger. Okay? So it's not 3 planes. So those are going to be like the radial carpal joint. So between the radius and the carpals here, those are going to be multi-plane, double plane joints. But you can't really rotate the wrist. The rotation comes from up here. And then you have saddle joints. So we're going on from page 35 on to 36. So those have a concave and a convex surface. So think of like the joint of, like a saddle on a horse, right? You're sitting on a saddle, you can move side to side like this, right? It kind of has a dish that way, and then it also has a surface this way from front to back. You have the horn of the south, right? So you can tip back and forth this way, and then you can move side to side. That's going to be this joint here. Right? So that's what makes the difference between humans and other animals if we get the opposing thumbs, right? If this joint didn't have that saddle joint, and then it would just be like these other fingers here, and all you could do would be like, well, I can't do it because I have an opposing thumb. If you didn't have the thumb, you wouldn't be able to use tools and manipulate things as much as you can as if you could do this. So now we're talking about more of a true ball and socket type joint. So that's going to be the glenohumeral joint and the hip joint of the acetabulum. All right, so those are going to be pretty much the most movable joints, especially when you're talking about the shoulder. The shoulder has a much shallower socket compared to the hip. All right, so now, how many planes of movement do you have in the shoulder joint? Yeah. Can you rotate? Yes. Can you rotate your hip? Yes. You got flexion, extension, abduction, adduction, internal, external rotation. So if you remember when we were talking about range of motion, there's the 3 P's of range of motion, right? You have the 3 different planes, then they usually have paired movements, and then when you're talking about evaluation, then you talk about the progression of how you assess range of motion. First, you ask the patient to actively move their joint, and then you're going to go and do passive range of motion, and then active resisted range of motion. But as far as this class, what you need to know are the first 2 P's, the different planes and the paired movements. And then in terms of when we're going to be talking about muscle, we'll talk a lot about origin and insertion. Origin is usually going to be considered the part that's the immovable part of the bone joint. There's 2 bones. One of them is going to be the immovable one, and the other one is going to move. The insertion is where it attaches to the movement. And like say, for example, muscles that move the shoulder, their proximal part is going to be usually the origin. The distal part is going to be the insertion. So my chest and my scapula are considered the immovable joint, whereas my humerus is going to be the movable joint. Now those can be reversed. If I'm doing a pull-up, then it's going to be different. Okay? So then the origin is going to move closer to the insertion. So most muscles are going to have a set origin and insertion for their more common actions, but those can be reversed. And then again, when we talk about those range of motion, again, it's going to occur in the different planes. All right. There's a few other planes that don't fit those specific 3. Like we'll talk about the plane of scapula. So the scapula, it's not in the sagittal plane, it's not quite in the frontal plane, it's not in the transverse. It's sort of at a different plane here. So it's usually considered about 30 degrees forward from the coronal plane or frontal plane. So when you're moving your shoulder, and when you're moving your arm in the plane of the scapula, it's like this. So when it comes to assessing joints, we talk about doing tests for the shoulder. We'll talk about doing shoulder tests in the plane of the scapula. For example, if you're going to test the supraspinatus muscle, you typically test it in an internal rotation or what's called an empty can versus a full can. So you're going like this, and then you're pressing down in this plane of scapula. Okay? And then at 90 degrees to that, you have the plane of the glenohumeral joint. Okay? So it's like when you're walking or running, your arms don't move straight forward like this, right? You tend to move more. That's the glenohumeral plane right here. So it's perpendicular to the plane of the scapula. Okay? Because your glenoid fossa, that's this plane right here. So it's like that. When you tend to move your arms, you tend to, when you're running, you tend to be moving like this. Okay? That's in the plane of that joint surface.